Welcome to Talk 1260 KTRC. You are listening to the Humanity Behind the Vanity. This is Dr. Daniel Ronel. I'm a plastic surgeon. I'm here with my wife, Betsy Ronel. I want to say thank you to the sponsor of our show, Suniva Medical, the makers of Artefill, one of my favorite fillers. And today we are going to talk about a whole variety of different things because we're doing our listener emails.
The whole show. And you know, we have to apologize for last week if anybody of you listened. We had introduced a topic that we were going to talk about, and we had to end our show. So we stuck in a pre-recorded segment. We had to end it early. So we never got to talk about it. But what's interesting is one of the topics we were going to talk about, somebody emailed him about this very week. So
there you go.
You're getting it anyway.
Okay.
All right, so the first one.
Yes.
Ready?
Mm-hmm.
Okay, this is about, okay, I'm not even going to say this one word, but fat freezing using the Zeltiq technology. That's exactly what we were going to talk about last week. I'm interested in fat freezing technology. I think I'm a good candidate. I'm 65-year-old male, very active, work out 6 to 7 days a week, reasonably fit, 5'9", 158 pounds, good health, blah, blah, blah. But would love to get rid of my love handles and tummy pooch.
Right.
Okay, using perhaps this fat freezing technique. What do you think of that?
So fat freezing is cryolipolysis.
That's what it is, yeah.
Cryolipolysis, and it's a machine that's approved by the FDA only for dermal cooling, for cooling the skin, for dermatologists who want to, for example, do a procedure and they want to anesthetize the skin. It is not approved for dissolving fat.
It says that some doctors use it. There's an article I read, I forget which magazine, but it said that they use it off-label.
Yeah, I use tons of things. Every
right,
doctor
of course.
uses
No,
things
that's
off-label.
normal,
Right,
but I'm just
normal.
saying, so some people are using it.
Right. But the reason I say it's not approved is because it does not make a whole lot of sense to me. What it does is the cold damages the fat cells because fat cells are more sensitive to cold than skin cells.
They shrink in the cold, right?
Well, what happens is they form little ice crystals in them, and the ice crystals poke holes in the fat cells and they die.
I just want you all to know something disgusting. Daniel has blood on his very fancy shirt sleeve.
Oh,
how disgusting. That will come out. Nasty! So he takes you all home with him in more ways than one.
I did 3 minor procedures in my office today.
And sometimes when he's been in the OR all day and he wears his scrubs home, the dogs lick his shoes and his pant legs. How nasty is that on a big lipo day or something?
Sometimes I have to take off my scrubs before I get home.
I just won't wash them in the washing machine. That's why I don't throw them away.
Anyway,
it's funny.
So what happens is the fat cells die and then the body absorbs them. It takes 2 or 3 months after treatment to do it. So it's not instantaneous.
Do you look so you don't look different at all?
I don't know. Nobody knows about this. It's
people
been done
do
a couple
because they're
times.
using it.
What's so amazing is that a couple people use it and it gets on the media and then everybody finds out about it.
It was in I think like Allure or one of those.
That's good public relations.
It's excellent.
It's good public relations because it's really not ready for prime time. And even when it is ready for prime time, I don't know a lot of people who are going to wait 3 months for them to see a small change because it's going to make a small change. The good news is, I mean, if this stuff really works out, it's painless. You just sit around reading a newspaper or something until the treatment is done. It doesn't hurt.
Do you have to wear a contracting girdle and all that like you do with regular lipo?
It's unclear. I would. But it's unclear. Anyway, the point is, cryolipolysis is not ready for prime time right now. Now, the other thing about that letter is the guy, I saw him. I asked him to come in because I wrote him back. I said, cryolipo is not a great idea, but there's other things out there. And he's, like you said, 5'9", he has like 15% body fat. I mean, he's got no fat under him. And I said, what you're feeling is excess skin. And when you have excess skin, it's really not, you're not a candidate for lipo. If you're very young and you have excess skin, then lipo can irritate the undersurface of the skin and it can really contract. So those people are somewhat of a candidate. But he's, in his 60s almost, and his skin ain't going to contract. So I told him what he really needed was a tuck, and because of his lifestyle, he's not ready for surgery. He's not going to have surgery. So that's the story with that one.
Do you think that he's just focusing on it for lack of, other things to focus on, or because
I don't know. He's very
it's a valid...
he's very balanced. It's a valid concern.
Oh, okay,
He's
fine.
He and his wife play tennis all the time.
Oh,
His
he's
wife
married.
he's from New York.
Fine.
She's from New York. She came with
Well,
him.
that makes him good already.
Right.
They were already on my good side.
Okay.
Yeah,
And so, it's just a little improvement. He's a lawyer. It's, he's kind of picky, so.
Okay, fine. I just thought maybe he was like going back
No.
into the meat market and
No.
nitpicking at himself.
No.
Fine, so he has a healthy
very
life.
nice relationship, yes.
Oh, good. All right, good. All right, fine. So you're not into it because it hasn't been FDA approved, not just because because of that.
I just don't think it works very well.
You just right, and
There
you're
you go.
right, okay. And really, like I've said before, if Daniel Ronel doesn't like it, it usually means it's not so great. And in fact, the doctors quoted in, I think it was the Allure article, but I'm not sure.
Right.
They were nobody I've heard of, which means that the big wigs are not using it.
About 3 or 4 months ago, the big thing was the Zerona, Zerona,
Right.
which is a laser type of removing fat, which is painless. It penetrates the skin, supposedly painlessly. And now the big doctors that were promoting the Zerona, who had a good PR machine behind them, now they're sort of downplaying it.
Right.
There was a recent interview with them following up on the big media hit, and a lot of them said they wanted to return their machine.
So funny.
Yeah, you got to be really careful about bandwagons. I mean,
Right,
the Zerona light doesn't even, the wavelength doesn't penetrate into fat cells, so I just don't know. The reason people lost fat on those clinical trials is because they had to stay on a diet while they were getting the laser
Oh, for
treatment.
God's sakes.
So, hello.
Anyone's
It's
going to lose weight that way.
It's like the
right?
HCG diet, which puts you on a 500
Right.
calorie a day diet. Who can live on
Yeah, that's
500
another
calories a
big
day?
trend, this HCG diet.
Yeah.
And so I just thought, okay, you either take the pills or you take the injections, but you're like on a starvation diet. So who isn't going to lose weight? I don't know how valid the HCG hormone is
Right.
compared to the fact that
Theoretically,
you're...
it makes sense because it sort of, quote, tricks your body into consuming its own fat.
But you're also
However,
starving.
Yeah, it's not, I don't think it's really safe right now.
Although I know
In
two
some
people...
hands it could be.
Yeah, I know two people who were on it, and neither of those people stuck to that absurd 500 calorie a day diet.
I have a lot of patients on it, and they seem healthy. It just
Right.
has to be carefully regulated, and I'm not sure it's the right. Any kind of diet which restricts food is always going to lead to yo-yoing, and
then
what
they
you
never
need to do-
last.
Yeah, any
Right.
kind of weight loss method needs to incorporate healthy supplements and needs to incorporate a
Exercise.
kind of exercise. Not always exercise, but you need
To
to
maintain
lose
it.
right. You need to lose your cravings for sugars and sweets. And if you eat healthy foods, non-processed foods, you're going to lose your cravings for those things.
Oh,
And
please,
that's
I've
what
eaten
it
like
is.
that. I never lose my craving for chocolate. Come on. And what's life without some chocolate thrown in every day, a few times a day? All right, we got 1 minute left here in this segment. We're going to do a
All right,
shameless
wrap it
plug
up.
of information. Go.
So if you want more information, please go to my website, www.danielronelmd.com. I'm changing it weekly because we have so many different things to add, different pictures.
Also, find him on Facebook.
I'm on Facebook. I
They
have
do
a fan
specials
page
and
there.
stuff.
Mhm,
Yeah.
mhm.
I sometimes write when you comment. I write in with my
Yes, she
little
chimes in.
comments.
Yes, and so anybody who says they like the radio show, they always say, "Your wife is great." They don't say anything about me.
Isn't that funny?
And so we've got a great tip by the great Dr. Rita Dodge coming up,
Yes.
and we'll be right back.